I'm excited to share the progress I've made on my capstone with you all today. My project is the development of a procedural safety curriculum for dermatology residents. My mentor was Dr. Harrington. Dermatology residency involves multiple daily procedures including biopsies, suturing, injections, all during clinic, in addition to excisions and Mohs surgeries. Our residency program doesn't have a formal safety curriculum, and most of our procedural training is done during busy clinic. Nationwide, about 3/4 of dermatology residents sustain sharps injuries during training, and nearly half of these will fail to report. In addition to the physical risks, nearly all dermatologic procedures are done on awake patients, introducing numerous communication barriers, both between a nervous patient and resident and between resident and attending. Qualitative studies have identified specific communication barriers during awake procedures, including hesitancy towards asking questions or correcting learning, and attendings taking over the procedure. I have designed a 4-hour curriculum for use during the first day of residency orientation in July 2020. To design the interactive communication session, I developed a needs assessment based on prior qualitative data. I aim to identify which communication barriers our residents face and determine their preferred instructional method. The remainder of the session is designed to present evidence-based safety techniques and allow plenty of time for practice. Pre- and post surveys will assess satisfaction, adoption of safety techniques in daily practice, and comfort with communication during awake procedures. The curriculum includes a brief introductory lecture covering background, sharps injury reporting, and examples of safety techniques, a skills session where residents can practice techniques on simulated skin, a practical session on inbox management, and finally, our interactive communication session, which will focus on identifying barriers to communication during awake procedures and developing strategies to empower better procedural communication throughout training. Examples of presented safety techniques will include tray organization, shielding suture needles between use, handling excess suture to avoid sharps injuries, and safe injection techniques. And my personal favorite, eye protection for every procedure. These are simple techniques that can be implemented in residents' daily routines. As the curriculum is designed for implementation during our upcoming residency orientation, I have no survey data yet. The curriculum is complete except for final design of the communication session, which is pending results of my needs assessment. In conclusion, I was able to design an evidence-based curriculum that could be implemented in a half-day during orientation. For my entrepreneurial mindset slide, I'm curious about whether we can improve communication during procedures with the ultimate goal of improving surgical education. During my design, I made connections with residents and other dermatology faculty. I plan to connect further with our dermatology surgeons once they both return from maternity leave, and with our nursing staff who are an integral part of our procedures. I'm eager to find out if residents will adopt these safety and communication techniques with the ultimate goal to decrease sharps injuries and to improve procedural education. As several specialties perform awake procedures, I hope my communication session can be generalized to other specialties. I'll end with my character artifact. Thank you so much, everybody.